Frozen shoulder can be a very debilitating condition which causes a lot of pain and restriction within the shoulder joint itself. And if you're currently suffering with a frozen shoulder, then you're probably wondering what is the best way of resolving this issue as quickly as possible, because I know it can really affect your daily life. So in this video, by the end of this video, you're going to have a much better understanding of what frozen shoulder is, how you know if you've even got the problem or not, and what you can do, the best options out there to resolve the issue as quickly as possible. Let's begin. Hello, my name is Dr. Stephen Hulme. I'm a chiropractor based in Reading, and in this video I'm going to be discussing frozen shoulder. I'm going to essentially go through what frozen shoulder is, how you can actually know whether you've got it or not, and then the best treatment options out there to resolve the issue as quickly as possible. So if you want to skip to any of those sections, then you can see the chapters below here. So we're going to start with what frozen shoulder firstly is. And so if we have a little look at the shoulder model here, the shoulder is basically, we got it, so this is the front and this is the back. So the shoulder is basically composed of the shoulder blade, which is back here, shoulder blade or the scapula, and then we've got the clavicle, which we can see at the top here, or the collarbone. So the collarbone is here, and then the scapula will be about here at the back. And then we've got the humerus, this part of the arm here, that's going to attach into that shoulder joint. And the way that the shoulder is going to work is that you've got a bunch of muscles that surround the shoulder that are going to either give you the power to move the shoulder, i.e. the deltoid that covers over this part here, and you're also going to have a few stabilizing muscles which we call the rotator cuff, which then kind of more really around the back and a little bit at the front that help to guide and stabilize the shoulder as you move it. Now surrounding the shoulder joint right here, you've got a capsule, and this is the part that frozen shoulder is going to affect. What this condition does in frozen shoulder is that it thickens and inflames the capsule, or at least parts of the capsule, around your shoulder, and this then causes a restriction in your movement, in the way that you move the shoulder, and it's going to cause a lot of pain, which comes mainly from that inflammation. The capsule, as you move the shoulder, the capsule should be fairly elastic, but in frozen shoulder, as it thickens, it has less of that elasticity, which causes that restriction. So it's very much a condition that is isolated very much into this area of the shoulder, right into the capsule there. There are generally two types of frozen shoulder. There's a primary frozen shoulder and there's a secondary frozen shoulder. Primary frozen shoulder is basically what we call idiopathic, which means that we don't really know what causes the problem in the first place, and the secondary one is caused by things like traumas and surgeries. So how can you know whether you've even got frozen shoulder? Well, the first thing, it's going to affect people usually between 40 and 60 or 65. Now that's not always the case, but typically that's the case, and it usually affects women more than men. So if you're in that category, you're more likely to suffer with it. It tends to affect people that have diabetes. There's around 10 to 20% increased chance of getting frozen shoulder if you have diabetes, and the pain itself is going to be localized around the insertion of the deltoid, which is around here, and then tends to be around the top of the shoulder and around the actual joint itself, and sometimes a little bit into the front. Now if you have frozen shoulder, it affects the capsule, and therefore the restriction within the shoulder movement is going to follow what we call a capsular pattern. This is a pattern of movement that becomes restricted in order if it's going to affect the capsule. So the first range of motion it's going to affect is external rotation. You can test this by putting your elbow by your side and then bringing your wrist outwards. This is going to externally rotate the shoulder here, and it's actually going to pull and stretch the capsule, particularly at the front here. And if you have frozen shoulder, you'll probably have around 5 to 10, maybe 15 degrees, depending on the severity of external rotation. If you can go 40, 50, 60 degrees of external rotation or more, then it's probably unlikely that this is a frozen shoulder. Now the next movement it's going to affect is elevation, specifically abduction. If you put your arm by your side and bring it all the way up to the top, if you can bring it all the way up to the top, it's very unlikely you have a frozen shoulder. usually if you have a frozen shoulder, it's very hard to get above 80, 90 degrees, again, depending on the severity. So if you are between the ages of 40 and 65, if you're female, if you've got pain around the top of the shoulder here, if you've got a restriction in your external rotation and abduction, then there is a good chance that you're going to have this condition. However, I wouldn't rely on this diagnosis. I would go see a professional such as a chiropractor or other doctor or specialist who can then properly diagnose you, because they'll be able to check the problems more specifically, and they'll also be much more used to seeing people with this condition, so they'll be able to more accurately tell you whether you've got the condition or not. So what can we do about it if we do have a frozen shoulder? Because this is a condition that can be around for quite some time, typically up to around 18 months, but it can be as little as a few months. Now this will depend on many things, but one of the things will be what you do in this time to fix the issue or to treat the issue. Now, before I go through what you can do, if you are new to this channel, then please do hit the subscribe button just right here to see new videos like this one twice a week currently. So what can we do? Well, the first thing is to go see a chiropractor or a manual therapist who can firstly, as we discussed previously, diagnose the problem for you, and secondly, check the function of not only your shoulder but also the spine, where the nerves come from, and also an area of the body where the shoulder relies on mechanically, to make sure that's working to its very best ability to give the shoulder the very best chance. And then also they'll be able to give you some more exercises more specific to you. So one of the major things that become a problem with frozen shoulder, besides the pain, is the restriction within the shoulder. And so one of the things we need to do is maintain the motion within the shoulder. So the one exercise I will give you is a mobility exercise, because you need to keep that motion within the shoulder. You need to keep moving it, because if you don't move it, its likelihood is the restriction will just get worse and worse. So what you'll need for this exercise is a stick. You can use a broomstick, or you can improvise with anything that you like. And what you're going to do is put the hand on the affected side on the end of the stick. Then with your good side, you're going to hold the bottom of the other stick. And so what you're going to do from this point is, using the good side, is you're going to move the affected shoulder, primarily just using the good side. So you're going to completely relax the affected side, so you're not getting any muscle contraction, and you're going to let all the power come from your good side. And this is why we need the stick, because the stick can really push that shoulder up. So what you're going to do is come into flexion and go as far as you can, and then just push that barrier a bit. It's okay to get through a little bit of pain. I wouldn't go too extreme, but there is a certain amount of discomfort you're going to have to get through to really improve that motion there. And then you can go into abduction, doing the same thing, just going up and down. Then you can do internal rotation, so you can place the stick behind your back and then pulling it up with the other hand. And then you can do external rotation, basically swapping the hands over, and you're then pulling the stick down with your good side, so that your affected side gets that more external rotation. Quite often, if you have frozen shoulder, you'll have difficulty doing things like brushing your hair or reaching your low back. So these things can help you to be able to get back to or continue doing these quite normal things with your shoulder. I would suggest doing this quite regularly throughout the day, and just do it as much as you're comfortable with. Now, if you've tried going to a chiropractor or manual therapist and you've given it a good amount of time, at least a good 2 or 3 months, if you've tried the exercise that I've given you and it's been a very long time, maybe it's been 6 to 12 months and it's just not going away, maybe it's just getting worse, or maybe it's just getting in the way so much of what you're doing and you just need to be able to get back to your daily life much quicker, then there are other options. However, before you go to or consider these options, you really do have to give the conservative route a good effort first, because most of the time these routes will give you the best relief, and particularly long-term relief as well. But if they don't, then there are other options. The first one is you can consider a steroid injection, where they inject a steroid into the capsule to reduce the inflammation. That can give some quite good results, usually more short-term. The long-term results aren't necessarily any better, and sometimes the long-term results might be worse, but I'm certainly not an expert on that. I would certainly consider consulting your GP or specialist, somebody that knows a little bit more about that type of treatment. And the other treatment that is done sometimes for frozen shoulder in some cases is surgery. But as I said, please do go to a chiropractor first and try as many exercises as you can to fix the issue, because almost everyone will get resolution through that path one way or another. So I hope this has been useful, and I know how debilitating this condition can be, and it can be a frustrating one because it can really linger around for such a long period of time. And if you really do use that shoulder a lot, then certainly this is going to be a massive problem for you. So I hope that you find resolution. If you want to ask any questions about this, then please do put those questions in the comments below. Otherwise, hopefully I'll see you on the next video. By the way, if you did like this video, then you might like my other video I've done, which was on shoulder impingement, which is another condition within the shoulder. And particularly if you realize after this video that you probably don't have a frozen shoulder, then you might actually have a shoulder impingement. So do click on this video here to find out the best exercise for this condition. Take care, and I'll see you next time. Bye bye.